I'm Carrie Benway. I'm the Executive Director of Your Hope Center.
And my name is Dr. Teresa Haynes, and I'm the Clinical Director of Your Hope Center.
Your Hope Center serves the community through 3 separate programs: Mobile Crisis Co-Response, Community Stabilization, and School-Based Services. Today, we're going to be speaking about the school-based services to share information about how community members can connect with a Hope Center clinician at their child's school, and also give a little bit of an overview of what type of service they can expect from the Hope Center program. Teresa, how about you start by saying what can a parent expect if their child is seeing a Hope Center clinician at their school?
Yeah, that's a great question, Carrie. And so our Hope Center clinicians are really, they're housed in the school, their offices are in the school, they work within the school hours. So it's a really no barrier access model of services. Our Hope Center clinicians are qualified, compassionate, passionate clinicians who work individually with students. They support families. They can also provide group services within the schools that they serve. And it's really, really a collaborative effort. So we do know that it takes a community, right? So the school counselors, the school administrators, and the family, along with the clinician, just wrap around care and services for that child.
One of the most meaningful things about our school-based program is that it eliminates the barrier, this being housed in the schools. Not only do we eliminate the transportation barrier, we also decrease the stigma of receiving mental health support. And that is so important for students to recognize that they have peers who are receiving support from a Hope Center clinician. We recently had a 4th grader announce to her class, "I'm getting help with my anger management issues from my Hope Center therapist." And just decreasing that stigma. And then the other thing that's really important for this audience to realize is that there are no fees for our services. Parents do not need to worry about whether they have money in their budget to afford this. All services are offered free of charge. And the other really important partnership with the school-based program, besides the school district, which is our key partner, is that the Hope Center school team communicates frequently with our Hope Center crisis team. Because what happens, Teresa, if a community member's child is at a school where there is not a Hope Center clinician? How can that parent access services?
Yeah, that's a great point, Carrie. So not only, again, with our 24/7 line, it's free of charge. Anyone, any age is able to access that. Also, I think an important way to point out that our school team and our crisis team work together is that when school goes on break, winter break, spring break, during the summers, our teams work closely together to just wrap up care. So if there's a child that the school clinician is concerned about what's going to happen during the break, are they going to be okay, we can put it on the radar of our crisis team. So we can follow up, we can check in with parents, we can just offer additional support to bridge those gaps.
And while the Hope Center school program is in 15 schools in our community, there are some elementary schools where we haven't expanded to yet. We are working on that right now for the 22-23 school year. But for parents who just really want to know, how can I access Hope Center services? Call our 24/7 line. That number is below, and we can, the person who answers the phone can learn more about you and your child. And if there's not a Hope Center clinician at your child's school at this time, hopefully it'll be coming in 22-23. But until then, we can help connect you to services.
Thank you.